What are the complications? Complications associated with rare pulmonary diseases can vary widely depending on the specific condition, its severity, and how well it is managed. The diverse nature of these diseases means that complications may affect different aspects of respiratory function and overall health. Here are some potential complications associated with rare pulmonary diseases. 1. Respiratory failure. Severe or advanced cases of rare pulmonary diseases can lead to respiratory failure, where the lungs are unable to provide adequate oxygen to the body or remove carbon dioxide efficiently. 2. Pulmonary hypertension. Some rare pulmonary diseases, particularly those affecting the blood vessels in the lungs, can lead to pulmonary hypertension. Increased pressure in the pulmonary arteries can strain the right side of the heart and potentially result in heart failure. 3. Chronic hypoxia. Chronic low levels of oxygen, hypoxia, due to impaired gas exchange in the lungs can lead to complications such as clubbing of the fingers and toes, cognitive impairment, and increased strain on the cardiovascular system. 4. Pulmonary fibrosis. Conditions causing scarring or fibrosis of lung tissue can result in reduced lung compliance and impaired respiratory function. This can lead to progressive dyspnea and may necessitate interventions such as lung transplantation. 5. Recurrent infections. Impaired immune responses in certain rare pulmonary diseases may make individuals more susceptible to recurrent respiratory infections. This can contribute to a cycle of worsening symptoms and lung damage. 6. Pleural effusion. Conditions affecting the pleura may lead to the accumulation of excess fluid in the pleural space, known as pleural effusion. Large effusions can compress the lungs, causing respiratory distress. 7. Pneumothorax. Rare lung diseases may be associated with an increased risk of pneumothorax, which occurs when air leaks into the pleural space, causing the lung to collapse. This can lead to sudden onset chest pain and difficulty breathing. 8. Cardiac complications. Pulmonary diseases that affect the heart and blood vessels in the lungs may lead to cardiac complications, including right heart failure. This can occur in conditions such as pulmonary arterial hypertension, PA, or chronic thromboembolic pulmonary hypertension, CTEPH. 9. Musculoskeletal complications. Rare pulmonary diseases that impact the muscles or chest wall may result in musculoskeletal complications, including deformities, limitations in physical activity, and chronic pain. 10. Quality of life impairment. The chronic nature of many rare pulmonary diseases and their impact on respiratory function can significantly affect an individual's quality of life. Symptoms such as dyspnea, fatigue, and pain can limit daily activities and social interactions. It's important to note that the potential complications can vary widely, and not every individual with a rare pulmonary disease will experience all of these issues. Management and outcomes depend on the specific disease, its stage, and the effectiveness of interventions. Early diagnosis, appropriate medical care, and a multidisciplinary approach are crucial for optimizing outcomes and minimizing complications in individuals with rare pulmonary diseases. How do healthcare providers diagnose rare lung diseases? The diagnosis of rare lung diseases often requires a comprehensive and multidisciplinary approach, given the diverse nature of these conditions. Healthcare providers employ a combination of clinical assessments, imaging studies, laboratory tests, and sometimes genetic evaluations to accurately diagnose rare pulmonary diseases. Here is an overview of the diagnostic process. 1. Medical history and physical examination. A detailed medical history is crucial in identifying symptoms, their progression, and any relevant exposures or risk factors. A thorough physical examination helps healthcare providers assess respiratory function and identify signs that may suggest specific lung diseases. 2. Pulmonary function tests, PFTs. Pulmonary function tests measure lung function and airflow, providing valuable information about the presence and severity of respiratory impairment. Spirometry, lung volumes, and diffusion capacity tests are commonly performed. 3. Imaging studies. Radiological imaging is often employed to visualize the structure of the lungs and identify abnormalities. Common imaging modalities include chest X-rays, computed tomography, CT, scans, and high-resolution CT, HRCT, scans. These tests can reveal signs of fibrosis, nodules, cysts, or other characteristic features. Bronchoscopy involves inserting a thin, flexible tube into the airways to directly visualize the bronchi and obtain samples for analysis. It may be used to assess airway abnormalities, obtain lung tissue biopsies, or collect bronchoalveolar lavage, BAL, fluid for analysis. In some cases, a biopsy of lung tissue is necessary to establish a definitive diagnosis. Biopsies may be obtained through bronchoscopy, video-assisted thoracoscopic surgery, VATS, or open lung biopsy. Tissue samples are then examined microscopically for characteristic features. 6. Genetic testing. Genetic testing may be recommended for individuals suspected of having rare pulmonary diseases with a known genetic component. Testing may identify specific mutations or genetic abnormalities associated with conditions such as alpha-1 antitrypsin deficiency, AATD, primary ciliary dyskinesia, PCD, or hereditary hemorrhagic telangiectasia, HHT. 7. Blood tests. Blood tests may be conducted to assess various parameters, including markers of inflammation, autoantibodies, and blood gas levels. For example, tests for antinuclear antibodies, ANA, may be relevant in autoimmune-related lung diseases. Given the complexity of rare pulmonary diseases, healthcare providers may collaborate with specialists in pulmonology, rheumatology, genetics, and other relevant fields to ensure a comprehensive evaluation and accurate diagnosis. The diagnostic process is individualized based on the suspected rare pulmonary disease and the patient's unique presentation. The involvement of specialists, advanced imaging techniques, and, in some cases, genetic testing contribute to a thorough evaluation and help healthcare providers make an accurate diagnosis. Early and precise diagnosis is essential for initiating appropriate treatment and management strategies to optimize outcomes for individuals with rare lung diseases. How do healthcare providers treat rare lung diseases? The treatment of rare lung diseases is often complex and depends on the specific condition, its underlying causes, and the severity of symptoms. Because rare lung diseases are diverse, treatment approaches may vary widely. Healthcare providers typically adopt a multidisciplinary approach, involving pulmonologists, specialists in related fields, and other healthcare professionals to develop an individualized treatment plan. Here are some general strategies and interventions used in the management of rare lung diseases. 1. Symptomatic management. Treatment often focuses on managing symptoms to improve quality of life. This may include medications to alleviate cough, dyspnea, shortness of breath, and pain. 2. Anti-inflammatory medications. For rare lung diseases with an inflammatory component, such as sarcoidosis or eosinophilic granulomatosis with polyangiitis, EGPA, corticosteroids or other immunosuppressive medications may be prescribed to reduce inflammation. 3. Oxygen therapy. Individuals with advanced lung diseases associated with hypoxia, low oxygen levels, may benefit from oxygen therapy to improve oxygenation and relieve symptoms. 4. Pulmonary rehabilitation. Pulmonary rehabilitation programs may be recommended to help individuals with rare lung diseases improve exercise tolerance, breathing techniques, and overall respiratory function. 5. Anti-fibrotic medications. In conditions associated with pulmonary fibrosis, such as idiopathic pulmonary fibrosis, IPF, antifibrotic medications may be prescribed to slow the progression of fibrosis and maintain lung function. 6. Antibiotics. Antibiotics may be used to treat bacterial infections or prevent recurrent infections in individuals with rare lung diseases prone to respiratory infections. 7. Immune modulating therapies. Conditions with an autoimmune component, like rheumatoid lung disease, may be treated with medications that modulate the immune system to reduce inflammation and prevent further damage. 8. Genetic therapies. For certain rare lung diseases with a genetic basis, such as alpha-1 antitrypsin deficiency, AATD, specific therapies may target the underlying genetic defect. 9. Lung transplantation. In cases of severe and progressive lung disease, lung transplantation may be considered as a therapeutic option. This is typically reserved for individuals who meet specific criteria and do not respond to other interventions. Supportive care measures, including nutritional support, pain management, and psychological support, may be integral components of the overall treatment plan. 11. Disease-specific therapies. Some rare lung diseases have disease-specific therapies that target the underlying mechanisms. Examples include enzyme replacement therapy for alpha-1 antitrypsin deficiency or mTOR inhibitors for lymphangioliomyomatosis, LAM. 12. Clinical trials. Participation in clinical trials may be considered for individuals with rare lung diseases, providing access to experimental treatments and contributing to the advancement of medical knowledge. Can I prevent rare lung diseases? Preventing rare lung diseases can be challenging, as many of these conditions have diverse and often complex causes, including genetic factors, environmental exposures, and other unknown or unpredictable influences. However, there are certain general measures that can be taken to promote lung health and reduce the risk of respiratory conditions. Keep in mind that these recommendations may not specifically prevent all rare lung diseases, but they contribute to overall lung health. 1. Avoid tobacco smoke. Smoking is a major risk factor for various lung diseases, including common ones like chronic obstructive pulmonary disease, COPD, and lung cancer. Avoiding tobacco smoke, whether by not smoking or quitting if you currently smoke, is one of the most effective ways to protect your lungs. 2. Protect against occupational exposures. If you work in environments with known respiratory hazards, such as dust, fumes, or toxic chemicals, take appropriate precautions. Use personal protective equipment and follow workplace safety guidelines to minimize the risk of lung damage. 3. Avoid environmental pollutants. Minimize exposure to environmental pollutants, including air pollution, and indoor pollutants such as secondhand smoke, mold, and other respiratory irritants. 4. Practice respiratory hygiene. Practice good respiratory hygiene to prevent respiratory infections. This includes proper hand washing, avoiding close contact with sick individuals, and getting vaccinated against preventable respiratory infections like influenza and pneumonia. 5. Maintain a healthy lifestyle. Adopting a healthy lifestyle can support overall lung health. This includes eating a balanced diet rich in fruits and vegetables, engaging in regular physical activity, and maintaining a healthy weight. 6. Avoid asbestos and radon exposure. Asbestos and radon are known environmental hazards associated with lung diseases, including mesothelioma and lung cancer. If you live or work in an environment where these substances may be present, take steps to minimize exposure. 7. Undergo genetic testing if indicated. In some cases, rare lung diseases have a genetic component. If you have a family history of certain respiratory conditions or if you experience unexplained respiratory symptoms, consider discussing genetic testing with your healthcare provider. 8. Follow medical advice. If you have a known respiratory condition or are at risk due to factors such as a genetic predisposition, follow your healthcare provider's advice. Attend regular checkups, take prescribed medications as directed, and actively participate in managing your respiratory health. While these measures can contribute to overall lung health and reduce the risk of some respiratory conditions, it's important to note that rare lung diseases often have specific and sometimes unpredictable causes. If you have concerns about your respiratory health or are experiencing symptoms, it's crucial to seek prompt medical attention. Early detection and intervention can be critical in managing and improving outcomes for various lung diseases. Prognosis. What is the prognosis, outlook, for people with rare lung diseases? The prognosis for individuals with rare lung diseases varies widely and depends on several factors, including the specific type of lung disease, its underlying causes, the stage at which it is diagnosed, and the effectiveness of treatment. Some rare lung diseases have a relatively stable course with appropriate management, while others may be progressive and associated with significant morbidity and mortality. Here are some general considerations regarding the prognosis for individuals with rare lung diseases. 1. Variable prognosis. The prognosis can be highly variable among different rare lung diseases. Some conditions may progress slowly over many years, while others may have a more rapid and aggressive course. 2. Response to treatment. The response to treatment is a crucial factor in determining prognosis. Some rare lung diseases may respond well to specific therapies, leading to symptom improvement and disease stabilization. In contrast, others may have limited treatment options, and the disease may continue to progress. 3. Severity of symptoms. The severity of respiratory symptoms and associated complications can significantly impact the prognosis. Individuals with mild symptoms and preserved lung function may have a more favorable outlook, compared to those with advanced disease and severe impairment. Complications such as respiratory failure, pulmonary hypertension, and cardiac involvement can influence the overall prognosis. Effective management of complications may positively impact outcomes. 5. Early detection. Early detection and timely initiation of appropriate treatment are critical for improving outcomes in many rare lung diseases. Early intervention can help slow disease progression, alleviate symptoms, and prevent or manage complications. 6. Individual factors. Individual factors, including age, overall health, and the presence of comorbidities, can influence prognosis. Some rare lung diseases may have different prognostic implications in pediatric populations compared to adults. 7. Genetic factors. For rare lung diseases with a genetic component, such as alpha-1 antitrypsin deficiency, AATD, or primary ciliary dyskinesia, PCD, the specific genetic mutations and their impact can influence the prognosis. 8. Lung transplantation. In certain cases, lung transplantation may be considered as a therapeutic option. The success of lung transplantation can improve prognosis for individuals with advanced lung disease who meet specific criteria. It's essential to note that ongoing research and advancements in medical understanding may lead to improved treatments and prognostic assessments for rare lung diseases over time. Additionally, the availability of targeted therapies and participation in clinical trials may offer new hope for individuals with these conditions. Because each rare lung disease is unique, individuals and their healthcare providers should have open and honest discussions about the specific prognosis, treatment options, and potential challenges associated with the particular condition.